We're here with Dr. Joe Fava, prosthodontist of Yorkville Village Dentistry, and we're kind of completing a bit of a circle here with Navident and ClaroNav. And Joe, can you kind of explain your initial experience with Navident?
Yeah, well, my initial experience, I just graduated from the program at the University of Toronto, and Dr. Yorkville, the director of my program, asked me if I could assist one of the other residents who was finishing up her master's, Esther Gans, Dr. Sumanji Gans, and she was working on a new technology called, the company was ClaroNav, and it was called the Navident, and it was a dynamic navigation system. And I know that there was a trial that was being run to look at the efficacy of the system itself, and basically I was involved in, even though I'm a prosthodontist, as a surgeon.
What year was that? Remember? 2013?
2013, yeah. 2013, yeah.
Today with a new Navident Evo, just released last year, in Dr. Fava's office, and we've just completed our first surgery with it. And first of all, just before we get into this surgery, what made you, decide to pull the trigger now, where you get the system in your office?
Well, firstly, obviously, a lot of the bugs that were in that prototype have been worked out. Mm-hmm. It's been miniaturized. A lot of the things that I can see, the improvements are enormous. The new cameras is a huge factor in the workflow of it, and the fact that it also adds photogrammetry. Yeah. And photogrammetry actually was the main reason why I was going to purchase it. The cost of photogrammetry is almost the cost of the system, and it made sense to do so. So to have the navigation as well as the photogrammetry all in one.
The photogrammetry aspect, kind of the reason that you purchased it, how do you feel about the simplicity of that system?
No, I think it's wonderful, and full arch cases, to be able to get that level of accuracy and to literally do it in a few seconds, it's pretty incredible.
Yeah, so we're going to keep adding things to it step by step. We're going to keep expanding the scope of Navident. We'll be doing some orthognathics and other things along the way that won't be applicable to everybody, zygomatics, pterygoids, all those things, but we'll just keep adding. We're doing our endo version as well now, which is out, and the endodontists are really excited. Yeah. How did it go today?
It went great. It was like riding a bike. I haven't used the system in about 10 years or so, but it was very natural feel. It was easy to just kind of get back on the horse, if you will, and use it. I could see all the nuances and all the changes in the system, but at the same time, how similar it was to the old system.
Right. Just better.
Better. Yeah. Upgraded.
Exactly.
2.0.
I noticed
4.0.
at one point, 4.0. At one point during the surgery, I noticed you were saying, I'm going to go off script a little bit. One thing, we changed the plan at one point, and then at another point, you just continued on, but you were still utilizing the system. Can you talk about that a little bit?
Yeah. So that's the one thing that I like about the system as well, is that in essence, it kind of gives you x-ray vision. So you're placing the implant with full data as to exactly where the implant's going while you're actually placing it. So I know exactly where the sinus was, I knew exactly where the adjacent roots were, and I was able to actually navigate that, not blindly, but with full information. And so yeah, it's great. So you can plan the implant, and sometimes plans change on the fly, but you can still work with it. And the system actually, in my opinion, works best. It almost makes you a super implantologist, if you will. It's like a superpower.
Awesome.
You have X-ray vision.
A superhero. And they've nicknamed, we do have another surgeon who nicknamed their system Clark for that reason. Your assistant nicknamed yours Chappie.
Chappie. So I have to go with the assistant. She says it's Chappie, so it's Chappie.
Yeah, the assistants run the show in a lot of cases, and they're very important to us. We're very happy that they're happy with it. Thanks so much. Full
pleasure.
circle.
Yeah,
really
real
appreciate
pleasure.
it. Thanks, Dr. Fava.